Watch this.
In the middle of a nationwide blood shortage, is it appropriate to not accept donations from a certain segment of society based on outdated information? LGBTQ advocates are asking for that to change so they can be part of the solution. Something else that needs to change: no race or nationality other than members of the white race. Yeah, those are rules written into the deeds of some homes in Idaho. At least 2 senators wonder why they're still there. Thanks to genomic sequencing, we usually have a pretty good guess when the next COVID variant will strike. But it's a process that takes up a lot of time. We went inside Idaho's public health lab to find out how it's done. We are in the middle of an emergency blood shortage across the United States, state of Idaho, and in the Treasure Valley. It's one of the reasons crisis standards of care has been declared across the southern part of the state. It's why organizations like the Red Cross are calling on any and all to donate blood. Well, not exactly all. Because did you know that gay and bisexual men are not allowed to donate blood in certain circumstances? The FDA rules clearly state men who have had sexual contact with another male in the past 3 months cannot give blood. Seems at odds with the emergency we're facing right now, and at odds with scientific knowledge. It's a policy rooted in the HIV/AIDS epidemic dating back to the 1980s. Critics point out a lot has changed since then, especially with advances in technology. So now LGBTQ advocates are advocating for the policy to change because, well, they want to be part of the blood shortage solution. Here's Joe Paris.
Amid a national and local blood supply crisis, advocates are speaking out on an FDA policy that bans gay and bisexual men from donating blood if they've had sexual contact with another male in the last 3 months.
It's time to move past that. This is a ban that's been in place for decades. It's harmful, it's hurtful. It's excluding millions of people from being able to donate blood.
Joseph Kibby is the vice president of the Boise Pride Festival. As a gay man, Kibby says it's very frustrating that people like him can't donate blood, especially during a crisis.
For me, it's personally shameful to opt out of blood drives and explain to coworkers and other people that I can't donate blood based on just being a member of the LGBTQ plus community. So it's time to be done. It's just antiquated.
Blood donation restrictions on gay and bisexual men date back to the HIV/AIDS epidemic in the 1980s. At the time, the federal government created a lifetime ban on blood donations policy for men who have had sex with men. In 2015, the ban was altered to allow gay men to donate blood, but only if they'd abstained from sexual contact for a full year. In 2020, that was changed to a 3-month waiting period.
Honestly, I haven't donated blood since I came out a number of decades ago, and only in compliance with that federal requirement. And I certainly would if I could.
Garden City lawmaker John McCrotzy says he has found that people are surprised to find out that the FDA rule heavily limiting blood donations from gay men is still active policy.
There are a lot of organizations that I've been involved with in the last number of years who, once you bring that up, they have that exact same experience. And they say, no, that's an antiquated rule that doesn't exist any longer. Yeah, it still happens today.
On their website, the FDA acknowledges that all blood donations are tested to make sure there isn't anything harmful in the blood that would make it a dangerous transfusion. Advocates question why there's only a ban on gay and bisexual men if we have the technology to detect issues. If there is an issue with any blood, it can be tossed, no matter who donated it. LGBTQ advocates point out it's a harmful stereotype that only gay men can contract HIV or AIDS to the point that it would compromise blood transfusions. The American Red Cross continues to push for policy changes that would allow men who have sexual contact with men to join the blood donation pool. They write, quote, "The Red Cross believes blood donation eligibility should not be determined by methods that are based upon sexual orientation and is committed to working with partners towards achieving the goal." The ACLU of Idaho agrees, especially during a blood crisis. They wrote to me in a statement, quote, "We do not believe that the FDA's current blanket 3-month ban policy is based in science because it does not engage in an individual risk assessment of potential donors. Eligibility for donating blood should be based on evidence backed by science and not harmful and outdated stereotypes."
I go to my doctor on a regular basis. I I keep myself healthy and I'm willing to help, but I can't. And it feels like your hands are tied. And it's just time to change that policy.
Advocates tell me they just want to help their community by donating blood and to be treated fairly.
I would do my best to be one of the first people in line. And if I have to wait at the back line, I'm happy to do that too.
For literally lack of a better term, was to roll up our sleeves and get it done. And it's time.
And we've been talking in our newsroom over the last few weeks. There really are a lot of people that are unaware about this policy, and there actually was some renewed attention on it in early 2020. During COVID, as it was really getting going, there was concerns. If for some reason we get into a medical emergency, will we have enough blood? And there was talk then in early 2020 about changing this rule. But Brian, as we come into now in 2022, there still has been no real movement on that in the sense of fully removing it, as we've talked about in this story. But the FDA is continuing to look at it. And supporters of really being critical and taking a close eye at this say that they want to just have more research done. Meanwhile, though, others in the medical community say there's been plenty of research done and we have the technology to do this safely.
We were talking about this policy of time. I didn't realize it was that recently, 2020, that they kind of pushed it up to that 3-month period, which still seems kind of, antiquated based on science. But you would think that there's a blood test or some sort of testing we could do to kind of put all this to the side and not have to worry about it anymore.
And there's a lot of testing you could do before before donating blood and after, Brian. So that's really what supporters are saying here, is that we have the technology to deal with this.
All right, just a matter of the higher-ups getting on board, I guess, and following through. All right, thank you very much, Joe. So while we're talking about Representative McCrosty, he continued his effort to end conversion therapy for minors in Idaho. Now, conversion therapy is an attempt to change one's sexual orientation or gender identity, a practice many call a pseudoscience. A quick Google search shows you can find these services offered throughout the state. Representative McCrosty, who introduced this same bill last year, says the practice is dangerous for several reasons.
Conversion therapy is any practice or treatment that seeks to change a patient's sexual orientation or gender identity. These often involve shame, verbal abuse, and sometimes even aversive physical techniques. This dangerous and discredited practice is opposed by prominent professional medical and mental health organizations. The danger in being exposed to conversion therapy is the damage it causes to the mental health. Survivors of conversion therapy are at high risk for attempting suicide, suffering extreme depression, abuse of alcohol and/or illicit drugs, and risky sexual behavior.
Not a good outcome. And if passed, mental health professionals licensed in the state of Idaho, could not offer such services to anyone younger than 18. However, it doesn't prevent this kind of therapy being done by parents or within a church, as long as any parent or religious counselor isn't doing it under the guise of a mental health professional. 20 other states, Washington, D.C., and Puerto Rico, and dozens of cities and counties across the country have banned such therapy already. And McCrosty's bill is based on a bill passed in 2019 by the Utah legislature, one backed by the LDS Church, by the way. Last year, the conversion therapy bill in Idaho never even made it out of committee. This year, it nearly got a unanimous vote to get a hearing in the Health and Welfare Committee. Representative Megan Blanksma was the only no vote. Okay, so we've got this $1.9 billion state budget surplus, and a lot of Idaho lawmakers want to give a lot of it back to the taxpayers. Tax relief is something both sides of the aisle agree on, and while we should appreciate that fact, an agreement on both sides of the aisle, we keep getting reminded they don't agree on what that tax relief looks like. Republicans proposed House Bill 436, centered on providing income tax relief for individuals and corporations. At $600 million in tax relief, it would be the largest tax cut in state history. But the Democrats don't like it so much. So today, House and Senate Democrats propose their own ideas on how to spend $600 million. And Andrew Bartline joins us to break down their proposal and explain how it compares with House Bill 436, which, as you know, has already passed the House and has now advanced to the full Senate.
That's right. House Bill 436 is moving fast, and the Senate Tax Committee just voted along party lines to advance that bill. The Democrats today explicitly said the bill's speed through this process is forcing their hand to respond fast. Breaking down 436, it's an income tax relief bill, kind of has two angles to it. First, the bill consolidates Idaho's 5 income tax brackets down to 4 brackets. Most notably in this shift is the highest tax bracket is lowered from 6.5% down to 6%. And to be clear, anyone who makes over $5 grand a year is in the highest tax bracket. The bill further returns money back to taxpayers through a 12% tax rebate or through $75, whichever is more. Democrats are critical of this bill. They say the wealthiest people and corporations are the ones who are going to benefit the most because the corporate tax bracket, too, is going to be lowered from 6.5% down to 6%. House Minority Leader Lana Repeal hasn't been shy about her criticism of the bill.
We thought it was really important because this is a $600 million cut. It is historic, and it is not something that we get a second bite at the apple on. We don't get to spend $600 million again, or at least we don't get to take that kind of revenue reduction again while still having any hope of funding infrastructure and schools and all the other things we want to target. And so we need to get this right. And House Bill 436 absolutely does not get it right.
Democrats support a repeal of sales tax on groceries and also providing property tax relief. Their approach is through funding investments rather than directly returning tax dollars back to the taxpayer. Democrats expect the grocery tax cut to cost $196 million and investments towards property tax relief to cost $380 million. So here's how that $380 million breaks down. $30 million will fund property tax assistance programs, $250 million will pay down school levies and bonds, and $100 million will go to local governments to fund their facilities or other needs. The Democrats say these investments will ease property tax burdens and make headway on other needs and priorities, like, as we see, funding schools. And that's what the Democrats fear with House Bill 436, that the bill could pass and then the opportunity to invest this surplus money in other areas will effectively be lost.
Okay, just so I'm clear then, like when it comes to these school levies, they'll pay off those levies, therefore the taxpayer in those taxing districts won't have to keep contributing to them. Is that what I understand?
Yeah, like a great example would be the West Ada School District. They have this levy, I think it's like $7 million, and every couple of years they got to vote to renew it, and it'll be tacked on to the local property tax. So if this surplus money just funds that levy in the first place, locally, your property tax wouldn't have to fund the levy. It'd be paid for through this surplus money. So in effect, in theory, in practice, it could cut down property taxes for people in West Ada, if we're using that example specifically.
True. All right. Well, we heard last week during the 436 debate, the Democrats saying we don't have enough money to do all of this, the tax relief, the grocery tax, and the property tax. Republicans saying there's plenty of money to do all of those things. So we'll see, again, what happens. Thanks, Andrew.
I think almost every person I've shared this with, their eyes get big as dinner plates and they say, oh, heavens, I didn't realize that language still existed.
Yes, this is one of those things you look at and you go, oh, that just isn't appropriate.
No race or nationality other than members of the white race shall use or occupy any building on any lot except that the covenant shall not prevent occupancy by domestic servants of a different race or nationality domiciled within an owner, I should say, or a tenant. It's a lot of words, a lot of ways to say this, but this is a section of the CC&Rs, the covenants, conditions, and restrictions attached to the deed of a house from June of 1941. And you don't have to be told the reasoning behind these words that are in these covenants. If you've ever bought a house, you've been shown such CC&Rs. Maybe not these, but maybe you didn't read them all either. You just had to sign them, kind of like you do with your phone and your apps. You just agree to it. And if you've bought a house that was built in, say, the mid-century subdivision or even older, then it's likely that language is still attached to it. This institutionalized racism and redlining that seems so far removed from modern-day America was once a common practice, even endorsed and encouraged by the Federal Housing Administration. Well, Senator Melissa Wintrow says there are likely thousands of such covenants still written in deeds throughout Ada County, even more throughout the state of Idaho. She gave the Warm Springs neighborhood and a subdivision on Vista Avenue as examples. Well, Senator Wintrow, who's from Boise, says it was brought to her attention by a constituent.
When he moved into his home, when he bought it, he had looked at his covenants, and right on the covenant it said in clear language, the only people that could purchase or live in the home were of the white race, and anyone otherwise, unless they were a servant, could not own or live there. And that was kind of a widely used practice all over the country.
Why, you may be asking, is this still an issue? Language like this couldn't possibly be enforceable in America, right? Well, you are right. In 1948, the Supreme Court outlawed using these housing covenants to deny people of color access to housing. They didn't say the language couldn't remain on the deed, however, just that it couldn't be enforced. It wasn't until 1968 when the Fair Housing Act made housing discrimination completely illegal. So any home built after that, after 1968, would not have that language in it. But before that, it likely still is. For example, Senator Grant Burgoyne, also of Boise, says his 1930s home covenant currently has it.
It crosses my mind from time to time that there are people in our society who know these kinds of things exist. They know there's still official records of the state of Idaho, and I just contemplate, how does that make them feel? I bet it's not good.
Can't be good. Even if title companies make it clear they aren't enforceable and usually just kind of cross them out, they're still there. Why not just delete these sections altogether? Well, it goes back to that 1948 Supreme Court decision. And because it's made clear in these CC&Rs, like with this deed from 1941, signed, by the way, by Mr. and Mrs. A&W Lincoln, these covenants and restrictions are to, quote, run with the land and shall be binding on all parties and all persons claiming under them until January 1st, 1987. It goes on to say after that, it extends in 10-year increments basically forever, unless a majority of all the lot owners in that neighborhood agree to change the covenants. And if that neighborhood doesn't have a homeowners association attached to it, a group that can usually help spearhead something like this, that can be hard to do. And as Senator Wintrow said, once something is recorded, it can't be unrecorded. By the way, it typically only costs a $10 fee paid to the county clerk to change covenants like this, and some have, just not all, which is why Senator Wintrow introduced a bill today that would eliminate that $10 recording fee, and the homeowners would get a document attached to the deed claiming said section is null and void, meaning you don't have to wait for your neighbors to agree with you. And any deed recorded after July of this year would be allowed to would not be allowed to include such language, I should say. This bill expected to get a hearing next week in the Judiciary and Rules Committee. Senator Wintrow told us today there's an effort right now to map out homes across the state where these covenants still exist. We hope to talk more about this bill and this map next week. Sequencing. It's how we know the COVID virus is changing. The more we can see that happening genetically, the better prepared we should be to take on the new variants. It's how we saw Omicron coming. So what are the labs in Idaho seeing? You know, we love questions here on the 208. Send us yours now or later. Text them to 208-321-5614. No question? No problem. Let's talk about what we've talked about on the show. Just make sure to include your name in the hashtag the 208. We hope to read yours at the end, but if we don't, there's always tomorrow.
Extraction of mRNA, DNA. We started out with Alpha, then it was Delta, now Omicron. We've heard a lot of Greek letters over the past 2 years to describe variants of the coronavirus. And the longer COVID sticks around, the higher our chances are of learning even more of the Greek alphabet as more variants pop up. Each variant brings on their own complexity, some worse, some more severe than others. But as we know, when you take a COVID test, it's either positive or negative. You don't get to know right away if it's Omicron or Delta. So how do you know which variant you may have tested positive for? And what if it's something else altogether?
Well, to figure that out, tests are being sent to Idaho Bureau of Laboratories, the beginning of a lengthy process. And Katya Stepovic spent some time there at the state lab to be part of the process from start to finish. Katya, help us understand how this works, please.
Brian, it is an extremely lengthy process, and I will tell you that. One single positive sample goes through about 6 different major steps in the sequencing process to determine what that variant it may be. From start to finish, this takes multiple days to complete. And the entire process from sample collection to the state reporting the results, that can take up to 10 full days if you're lucky. The Idaho Bureau of Laboratories has employees working overtime to fill the demand of needing to sequence positive COVID tests to detect variants.
If you would have asked me 3 years ago that I am where I am right now, I would not believe it.
We try to make sure that we're balancing the resources that we have with the need to get information out to the public. So we do our very best to make sure that we're not burning people out. The sequencing program has been one of those that has grown in proportion to the pandemic. So if you think about, if we're trying to, as a goal, sequence 10% of the positive samples, then you can think about right now where we've got, lots and 4,000 cases a day. That's a lot of samples that could be rolling in for sequencing.
And they've definitely been able to sequence more and more as time has gone on with this pandemic. The lab can start on about 300 samples a day, but with it being a days-long process, they can complete about 600 per week. In 2020, the Idaho Bureau of Laboratories sequenced 574 positive tests. In 2021, that grew to almost 4,000 positive tests. So far in 2022, this year, they have sequenced 429 positive samples, with the demand constantly increasing every single day. Now, 98% of last week's sequenced tests alone were Omicron. Brian, as you can imagine, there are so many intricacies involved in this process, and I saw it firsthand today. We spent a lot more time than was predicted. So next Tuesday, right here on the 208, I will have an in-depth look at what those processes are and how all the contents in that little nasal swab ends up in a highly advanced computer system that tells us what variant is circulating right here and now.
All right, between now and next Tuesday, just enough time for you to get your PhD, Katya, and help explain this to us. We'll tune in. Thank you very much.
My brain is like, wow.
I can imagine. All right, thank you very much. All right, ran a little long today, but a couple of comments to wrap up the show. I like the idea of using the surplus on paying off school bonds. That will lower our property taxes. Removing the sales tax on groceries makes a lot of sense, too. Both make a lot more sense than a one-time $75 tax credit, says Laura. And this one, so Magic Johnson can donate blood, but members of the LGBTQ community cannot? That makes sense. Actually, it's not true. They do not take blood from HIV-positive people. So there's that. But that could change for the LGBTQ people.